you talked a little bit about decreased desire, so hypoactive sexual desire disorder, which is actually a DSM category and actually a diagnosis that people can use in practice for women that come in with decreased libido. And a lot of times the way that we approach that is by looking at the biopsychosocial model. Okay. And what that is that we will first go ahead and assess the anatomy and make sure there's nothing anatomical going on for which, you know, a person may be experiencing decreased libido. Mm-hmm. One of the causes of that may be, for example, say if the woman is perimenopausal or menopausal and she's having what we call the genitourinary syndrome of menopause, which is where you have like painful intercourse due to vaginal dryness, and or you know, if you have recurrent UTIs or if you have recurrent infections, any of those things can cause for painful intercourse. So the bio part of it is looking at anything anatomical or even medical. Say that somebody has, you know, diabetes for which they're taking medications or high blood pressure for which they're taking medications. Sometimes those medications can affect desire and cause decreased desire. So that's where we start out with typically is the bio part of it. The psycho part of it is the psychological aspect of it. And that's, you know, of course, where you come in. And, you know, is the person suffering from anxiety? Are they suffering from depression? As you know better than anyone, is that can significantly impact relationships. And oftentimes when patients are taking medications, for example, antidepressants, such as SSRIs, we know that a common side effect of that is decreased libido. And for people that may not know what an SSRI is, that's, you know, those antidepressants like Zoloft and Paxil and all of the, right, Prozac, right? Those are the most common ones that oftentimes patients will use, and that can affect how a patient feels and a decreased libido. We also know that sometimes birth control pills can affect libido as well, right? Sometimes calcium channel blockers, that can affect libido. And we know that Wellbutrin actually helps. And for patients that are maybe depressed and if they're able to switch medications, we know that Wellbutrin, it does not affect libido as much as something like an antidepressant like Zoloft and Paxil. And then the social model of it is where, you know, what is going on in that person's life, right? Are they a single mom that's trying to raise like kids on her own, like 3 jobs? You know, does she have so much stuff going on in her life that the last thing she's worried about is, you know, physical intimacy with her partner, right? They also say that uneven distribution of household chores, for example, if somebody is, right? So a lot of times working moms have this where they're working outside of the home, and as soon as they come home, they start their second job, right? Where they're taking care of the kids, they're taking care of the house, they're making dinner, all of those things. So that can definitely affect libido, because if you're constantly exhausted from doing everything else, you're not going to have enough reserve to interact with your partner in a meaningful way. Right. Absolutely. And also the social aspect of it comes in when you have some type of cultural negativity. And like we talked about before, some type of abuse, some type of trauma, any of those things can also affect libido. So when we look at a patient, when someone comes in with decreased libido and this hypoactive sexual desire disorder is only diagnosed when it is distressing to the patient. So if she is experiencing decreased desire, but it's not distressing to her, then it's really not a problem. Right. It's only a problem if it's, you know, impacting her life in a negative way and she wants to change it, then that's when we start to go ahead and assess it.